So we've been on the bike now for 10 minutes and we've been gradually increasing your heart rate from 40 to 70% of its maximum. So how's everything feeling? Is your knee feeling okay?
Yeah, it feels okay.
It feels okay? All right, so it's really good now because all the blood's rushing through your body and we've gradually raised your heart rate and your blood pressure, ready for our resistance training. Now, at any time today that if you start to feel any pain in your knee, your right knee, please let me know, okay? And the doctor has also informed me that you have a little bit of bilateral knee and hip osteoarthritis. So please let me know too if you have any pains in those areas as well. All right, so this is our resistance part of our training for you. I'd like you to do this twice a week with 2 days in between. All right, so let's get started. If you can stand up for me. The first exercise we're doing today is a wall push-up. Okay, so all of these exercises I've designed with the aim in mind that you would like to eventually get back into that running. Okay, so I know you don't like lifting heavy weights. So today we're just going to do gradual. With pretty much everything is just your body weight that we're using. So if you just watch me for a moment with a wall push-up. All right, so we've got our hands shoulder width apart and we're looking down and we're coming up and down. As you can see, we're pushing our body as one, like a plank, and make sure that you don't hyperextend your shoulders or they come up. All right, come on over here, Harold, and give it a go. What we're doing with this, we're going to do a set of 15 and we're doing that twice, okay? So it should be, there we go, perfect. Excellent. How does that feel?
Feels fine.
Feels good? Does it feel like it's hard enough? Might need to do a little bit harder. I might get you to step back a little bit and then you'll have more of your body weight. There we go. Excellent. Wonderful. So your shoulders are staying in position, your body's moving as one, and your head's down. Fantastic. Perfect. Just making sure you're squeezing your scapula together there. All right, so this exercise, of course, is really good for our triceps, for our pecs, our pectoral major, and anterior deltoids. All right, excellent. So that's 2 sets of 15. Okay, feeling good?
Yep.
Wonderful. All right, our next exercise, we're going to use a resistance band. Okay, and this one is a row. So it's a resistance band row. And you're doing about 60% of maximum for this. All right, so you need to just make it tighter if you don't think that it's hard enough. All right, so what I'm going to get you to do, you're going to put one foot onto the band and just being wary of that knee of yours, leaning forward, and it's a row. So what happens is our elbows stay in tight. We're reaching up and down. Perfect. Make sure those shoulders stay where they are. And we're bringing our elbows back. All right, so let's jump you onto this exercise. Now, of course, with this exercise, we're using our middle trapezius, our rhomboids, our posterior deltoids, and our biceps. Excellent. Make sure those elbows are in tight. Fantastic. So we're squeezing our scapula together. That looks wonderful. How does that feel resistance-wise? Does it feel about 60% of what you could do?
Oh, yeah.
Excellent. That looks wonderful. Oh, you look wonderful. So that's great. So it's just like a string is pulling your elbows back in a nice straight line. That's fantastic. Excellent, Harold. So we've got 2 of 15 of that. And how's everything going? How's your hips and your knees?
Yeah, they feel all right.
They're feeling good? All right, you're doing wonderful. Okay, our next exercise is a squat. Now, because of your knee reconstruction, we're just doing a partial squat. So if you can watch me, I've got my feet shoulder width apart and my knees are tracking my toes. I'm looking up and my chest is staying high and you're coming down to 90 degrees. No more than that because of your knee. And then squeezing up, and at the top of your squat, I want you to squeeze your glutes together. So down into our partial squat. Now for balance, you might want to hold out like this. That can help with your balance and holding your chest up high. All right, so what we're doing here is we're strengthening our hamstrings, our glutes and our quads. Fantastic. Yep, that's good depth, so make sure we don't go any more than 90 degrees. How's your knee feeling?
Yeah, it feels alright.
That feels good, and make sure you look straight ahead so that your back stays up. We just want to make sure there's no flexion of the spine. So that's excellent. Well done. Make sure you're pushing through the heels. Fantastic work, Harold. So we've got 2 sets of 15. All right, well done. So our next exercise is a glute raise. So, did you just want to get a drink of water quickly?
Yep.
All right, Harold. So if you can just watch me now, we're doing a glute raise. So what we're doing here is we're trying to strengthen up your hamstrings and your quads, all of our muscles around your knee reconstruction so we can get you out there running again. So what we're doing with this one is we're squeezing our bottom, our gluteus. Squeezing it, and as we're squeezing, we're pushing through the heels. So our hamstrings are staying nice and relaxed, and we're just squeezing our glutes together. Okay, so if you can come on over here, and we'll give that a go. So this is going to be a great exercise to get your strength back. Okay? All right, Harold. So that looks good. Feet shoulder width apart. Okay, so you're pushing through your heels, and what we're doing here, we're squeezing our glutes. So just our bottom is squeezing, and you're pushing through your heels while you do that. Fantastic, and those hamstrings are staying nice and relaxed. So it's just your bottom's pretty much doing all of the work. That's excellent. So we're doing 2 sets of 15. How does that feel on your hip and your knee? That's okay?
Yeah.
All right, that's fantastic. So you should be raising up your glutes as high as you can, pushing through your heels. Fantastic. So 2 sets of 15. All right, you're doing really well, Harold. If I can get you to take a seat now, we're going to do a single leg calf raise. Okay, so what we're going to do is leave our legs, our knees at about 90 degrees. Okay, so if they can just come forward a tiny bit more. Excellent. So what we're doing here is we're working our calf muscles. So we're going to do 1 at a time, and we're going to do 2 sets of 15. Okay, so what we're going to do, we're going to do it nice and slow, and we're going to hold it up for about 1 to 2 seconds. So, okay, so let's pull our heel up for me. 1, 2, and relax it. And again.
Leo.
1, 2, fantastic. And again. Well done, that looks great. And no pain anywhere?
No.
Okay, fantastic. So what we're doing is we're just following on from the 12 months of rehab that you've already had on your own. All right, so we're just following on from your 12 months rehab, and that looks great. So nice and strong, holding it there for 2 seconds. Fantastic. So we're going to do 2 sets of 15 as well for that one. So the big muscles obviously are the gastrocnemius and the soleus, okay? And just make sure it's nice and slow, because we don't want to put too much pressure on the Achilles. That looks fantastic. All right, we've got one more exercise, Harold. You are doing really well. You feeling good?
Yep.
Excellent. Okay, our last exercise, we're going to be working your core muscles, getting it nice and strong for when you get out there and you get into your running again. Now, are you enjoying this program? It's not too much weights, and that's what you don't like? Okay, fantastic. So we've got a plank to finish. Okay, so for our plank, we're doing 2 sets of 60 seconds, so 2 sets of a minute. With your planks, Harold, make sure your whole body is like a straight plank. So your bottom's squeezed and your abs are on. Your elbows should be directly under your shoulders. Your body should be like move as one big plank, and you're going to hold it and squeeze all those muscles and hold it for 60 seconds. Okay, so this is working our back and our abs, all of our core muscles. So come on down and let's have a little look. Just got to make sure we don't get any hyperextension of that spine. So our transverse abdominals are the muscles that work really hard here. All right, that looks fantastic. Very good. Your body's as nice big straight plank. Your elbows are under your shoulders. How does that feel? Good. All right, we're going to hold it for 2 sets of 60 seconds. So hold it there for me. Wonderful. That looks fantastic. All right, Harold. So if you can just gradually stand up now. We've done our 2 sets of 60 seconds. Okay? And what we're going to do is we're going to do a 10-minute nice relaxing cool down on the bike. We're going to reduce your heart rate from 70% to 40% again. And then we're going to finish with some stretches. So making sure that we stretch all of the muscles that you've worked today. So how did you feel? How did you feel in this exercise? You didn't have any pain?
No, it's fine. My leg and knee and hip have held up all right.
Yeah, fantastic. So you feel good. There's no pain, which is the main thing. And with your program, so just while you're doing your warm down, I'm just going to talk to you a little bit more about your program, because what we've put in, we've also got 2 days where I'd really like you to get some cardiorespiratory training. And I know there's some exercises you don't like and you love the walking and the running, but we'll get you back to that running. For now, I want you to focus on doing some walking or some stationary bike or cross trainer. And then the other session is the aqua class, which is something that you said you'd be happy to give a go. And while we're doing them, we want your heart rate to be at least 50%. So we want you to start working a little bit harder, but we don't want it any more than 70%. So if we can get it up to 70% when we're right in there, when our heart rate's at its highest, then that would be fantastic. Okay, so we've got 20 minutes of the walking, bike, cross trainer, and then 40 minutes of your aqua class. And your aqua class should be really good cardiorespiratory, but also for strengthening that body, and it's not a high impact exercise, which is fantastic. All right, is there any of the exercises you really enjoyed today? Which was your favourite?
I'd probably say the plank.
The plank, you were really, yeah, you did really well. All right, was there anything you didn't enjoy today? Okay.
Probably the resistant band.
Yeah. Okay. Alright Harold, so you've done great. We're going to finish with the 10 minutes of the cool down. We've had a chat about the extra exercises and not forgetting to do this twice a week, and our cardio at least twice a week as well. And in our stretches today, we're going to be stretching out your chest, your hip flexors, your quadriceps, your calf muscles. Okay, and we're going to also incorporate some of the foam roll, which I've talked to you about. And we're going to be rolling and stretching out our lower back, hamstrings, ITB, and your calf muscles. Just making sure that recovery from your knee replacement is nice and smooth, and we can get you out there on the running track. Well done today, Harold.
Thank you.
Thank you.